Healthcare is big business in the United States. It makes up 20% of our gross domestic product. For us, the buyers, it's a seller's market. What does that mean for you? WIS News 10's Jennifer Emmert joins us with what she has found, and I am surprised at what you have found.
Surprising and shocking numbers, and it differs whether you have health insurance or if you're using Medicare or Medicaid or paying out of pocket. So over 3 stories, we'll take a look at just how big healthcare is here in the Midlands, what it's costing you, and what can be done to help lower your costs, and the questions you need to ask your doctor before treatment.
In South Carolina, healthcare is a $35 billion a year business. Just ask an economist.
It is a business. It is not a charity. It is not a feel-good.
One of the biggest in that business, hospitals. The Kaiser Family Foundation found hospital care amounted to 40.4% of healthcare costs in the state.
We now spend, on average, probably $8,500 per person in South Carolina for every man, woman, and child on health care. That's the $35 billion.
Who are the Midlands' largest employers? The top 3, Palmetto Health Alliance, Blue Cross and Blue Shield of South Carolina, and Lexington Medical Center. Why does that matter? You're never sick, so that doesn't affect you, right? Wrong. Healthcare costs can turn up in unexpected places, like the price of a new car. Consider this: when GM sells a vehicle, $1,400 of what you pay is paying for GM's employees' health insurance. The National Institute of Medicine estimated in 2009, $2.7 trillion in the U.S. is spent on health care, but they claim $765 billion is potentially excess spending. That's right, billions spent on what they consider unnecessary tests or procedures.
You hear CMS talking about it, you hear the Innovation Center talking about it, and you've heard Tony Keck in South Carolina talk about how we need to be paying for value, not volume.
Meaning cut down on healthcare costs by not rewarding medical providers for the procedures they do.
Research has shown that there are unnecessary surgeries, unnecessary hospitalizations, unnecessary procedures that go on every day in this country, that if more preventive care was provided, if people's lifestyle changed, if they took, in some cases, more responsibility for their health, we could save money and improve lives.
So what are those unnecessary procedures? The American Academy of Family Physicians' top 3. Don't get screened for osteoporosis if you're under 65. You don't need an antibiotic for a sinus infection. And you don't need an MRI for lower back pain in the first 6 weeks. The South Carolina Department of Health and Human Services believes hospitals talking more about their cost also helps.
It's important for the public to understand what the costs are, what the expenses, and what the profits are of certain hospitals.
They found from 2008 through 2011, Palmetto Health Baptist had $36.1 million in profits. Providence Hospital pocketed $41 million. Palmetto Health Richland $90.6 million in profits, and Lexington Medical Center with a profit of $205.9 million. We tried to talk with all 4 hospitals, but all declined interviews.
It's not like any other business. It's a very different business. And there is an infinite demand for health care.
These businesses create much-needed jobs. Healthcare jobs in the state grew fast, more than 60,000 jobs from 2000 to 2011, according to the Board of Economic Advisors. The Catalyst for Payment Reform report card on state price transparency laws gave South Carolina an F. It's why many say it will take more than the Center for Medicare and Medicaid comparing prices at hospitals nationwide to reform prices.
So what does that mean for you, and why should the same procedure cost $1,000 difference at 2 hospitals owned by the same parent company? Don't miss the second part of our investigation, where we look a little bit closer at these costs, coming up tonight at 5:30.
Shopping around, literally.
Shopping around.
But not knowing the final price till...
It's too late.
Yeah, till you're through everything.
You got to do your homework.
Yeah, thanks, Jen.